This is NBC Connecticut News at 11.
This is an age-old problem that frankly is not going away. Not only does it affect many people, bullying is hard to shake even years after it happens. Dr. DrKrasner is here from Silver Hill Hospital. Good morning to you, and thank you so much for coming in.
Good morning. Nice to be here.
So this is a conversation that we have to have because this hits home for so many people. And we should clarify right off the bat that a mean comment or, kids being kids is very different than actual full-blown, full-fledged bullying.
Absolutely. It's important to remember that the key definition for bullying is a power dynamic that is different. Someone feels stronger, someone feels weaker, and that difference is exploited. And it has the potential to go on and on unless it's intervened upon. And that is potentially very dangerous for not only the victim, but really also for the bully. And I hope we get a chance to talk a little bit about how we can help not just victims, but bullies as well.
Very important, because we
Yes.
have to stop it or the cycle continues.
That's right.
There's also a really important thing that you've come up with. It's a paradigm. Talk about the three sides of that and what the implications are.
So I can't take credit for coming up with the paradigm. It's sort of a psychological thing. But we think about bullies and victims and bystanders.
Okay.
So bullies are people who are exploiting a victim for whatever motive. And the victims tend to be different in one way or another. That's a classic risk factor for being bullied. You're different in one way or another. And being different can be different in so many different environments. And then there's someone who's watching this go on, and the witness to that aggression that goes on between the bully and the victim is pretty potent and has lasting implications for that person as well. And until we address the whole paradigm and we think a little bit about the bully, what goes into being a bully, what goes into being a victim, and what the implications are for someone who's watching it, you're right. It's going to be very hard to change this very long-standing, entrenched piece of human behavior.
That person watching, I've been that person, I've seen it happen, and I can't help myself. I go and I defend the person, and I don't know if that's what you're supposed to do. What should that person in that side of the paradigm do? You're watching it, and I just feel my blood rushing, and I go help that victim, and I take on the bully.
Well, you are a charismatic, awesome person.
Oh, thank you.
So that is part of why you do that. But it also brings some risk on for you.
It does, certainly.
And what we call you is an upstander.
Okay.
So you go from a bystander to an upstander.
Like that.
And when you go upstanding, then you run the risk of becoming a target.
Right.
So when I talk to my kids who I treat or on my unit or families, etc., I try to educate them that if they're going to become upstanders, they better be ready for what's coming next.
Yeah, and when you're an upstander, you're not even thinking about it. You're like, I just have to stop this. Oh, no, you're not getting away with that,
Yeah.
So we all have a role in this in some way.
Yes.
Talk about the toolkits that you've created, because we're not here just to talk about the problem. We want to empower and help and educate.
Absolutely. There's toolkits for helping. Well, we created a toolkit at Silver Hill for helping families to help each of the participants in this kind of paradigm that we've described. For victims, we want to listen to them.
Okay.
We want to recognize risk factors, being different in one way or another. We want to recognize cardinal signs and symptoms of being bullied, which might include school avoidance or low school achievement, whereas they had been performing higher previously, or fears, etc., perhaps some signs of anxiety or even depression. For parents of victims, we want to empower them to talk to them and to engage with them in a discussion about what can be done to help them to advocate for themselves. Sometimes that involves going to the school, sometimes that involves going to the authority. It's very case dependent. On the bully side, we really want to help parents to be connected with their kids. A lot of bullies don't know they're being bullies.
Right.
And they fall into a mean crowd, or they're just trying to fit in.
It's not who they are.
And it may not be who they are. On the other hand, there are straight up bullies.
Definitely.
Who are predatory and who parents need to work with and often refer for help. And on the bystander side, we want to be engaged with our kids. If I could say anything to your viewership, Be engaged. Check
Yes.
in.
Yes, totally.
Spend a few minutes. What's going on at
Put
lunch?
the phone down.
Put the phone down.
smartphone
What's
away,
going on the bus?
Right.
What's happening?
Just
Who's
talk
doing
to
what?
them.
Talk to them.
Yeah,
Love
make
them.
them feel like the conversation can happen and love them. And you know what? It's 2015. Different is cool.
Different is
Okay,
cool.
Molly's, different is cool. All right, you're awesome, Dr. Krasner. Thanks for coming in. Let's keep the conversation going, right?
Let's do it.
As I said to him earlier, this is just the cocktail hour. We want to keep that conversation going. All right, thanks so much.